Hello everyone, welcome back to our channel. This video today is not a continuation of the previous video. It is a separate video, and from the next video I will continue the previous topic. Now the topic for today's video is coronavirus. Now today I won't be talking about how it affects our body, our immune system, our lungs or anything. In this video I'll just explain you a small detail about it and how it affects our body. The first point, what is coronavirus and how does it spread? So coronavirus is from the family of SARS, severe acute respiratory syndrome, which was found or surfaced in the year 2000s. Now it spreads via droplets when someone who is infected coughs, or if you touch someone who is infected and then touch your eyes, nose or mouth, the T region, eyes, nose and mouth. Through them the virus enters our body, and after entering it travels to the lungs, spleen or intestine. But the most dramatic effect is on the lungs. Second point, how should we react? Now the most important thing is not to panic. Most people infected with coronavirus will experience a mild to moderate respiratory illness and will ultimately heal without even requiring special treatment. The only people who have a severe effect of it are those who are of old age and already have low immunity or heart or lung diseases. Okay, now these kind of pandemics have two futures: fast pandemic and slow pandemic. Now in fast pandemic, a lot of lives are lost, a lot of people die because a lot of people simultaneously gets infected, and there are less medical staff, less medical equipments. As a result, many people die even being untreated, even without being treated. But in a slow pandemic, it is the opposite. A little people, some people, only some people gets affected, and the medical staff have a lot of time to find a cure for it. Third point, what is our responsibility? So we have two responsibilities. First, not getting affected, and second, not infecting others. Now, how should we protect ourselves? First, not touch surfaces that you think a lot of people have touched. When you go out or you see that there are some places when you think that a lot of people have already touched it, avoid touching those places. Second, maintain distance between you and others. Okay. And the third one is to wash your hands. Now, when I'm saying wash your hands, it doesn't mean specifically that you have to get sanitizer or some expensive soap. A normal to normal soap will have the same effect on it. Now, how does soap works? The structure of coronavirus is that it have a protective fat layer, okay, that protects the virus. Fat layer. Now if you just wash your hands with water, it won't have any effect on it. The water will just pass through it, just like how you pour oil in a water. Okay. Now, when you wash your hand with soap, what it does is it breaks the protective layer, the layer that protects the virus. Soap breaks it. As a result, it kills the virus. Okay, but for that to happen, there is one important thing, that is to wash your hands for 20 seconds. If you wash your hands for 5 seconds or 10 seconds or 15 seconds, it won't have the same effect. For breaking the protective layer and killing the virus, it requires time, and that time is minimum 20 seconds. Wash your hands properly. With this, I'll be stopping the video here. I'm advising you all to follow the basic hygiene, to follow the rules that are implemented there and the rules given by WHO, World Health Organization, as well as the government. Use masks, avoid going to crowded places, and take care of your family and yourself. That's it. Goodbye.